Actually, it was a very nice debate about using the reversal agents before IVT. Actually, the debate was more about the reversal agent Idarucizumab, which is a reversal agent for Dabigatran, because we know that for the reversal before IVT, we can only use the Idarucizumab, so the reversal agent for Dabigatran. The reversal agent for factor Xa inhibitors, which is Andexanet Alfa, is not supposed to be used before IVT according to the ESA guidelines. About the Idarucizumab, the number of real-life cases is increasing, published in the literature in the last years, and we have quite a lot of data about reversal agent Idarucizumab before IVT. Therefore, there were nice analyses already done according to the real-life data about the efficacy and also about the safety of Idarucizumab use before IVT in patients on Dabigatran who suffer acute ischemic stroke. We have also done a very nice systematic review in year 2021, and we have already published that systematic review about the real-life data according to use of Idarucizumab before IVT. And in that systematic review, we found that the efficacy and the safety of this therapeutic strategy was comparable to efficacy and safety of IVT in patients who were not treated with or anticoagulation. So the results were, let's say, very encouraging. And as I said, the number of clinical cases in real-life practice is going up. So we have more and more data about safety and also about the efficacy of these therapeutic strategies. So the CONy, we had a very nice debate if reversal of Dabigatran activity with Idarucizumab is a good point or not. And yes, from my opinion, there is right now quite a lot of reassuring data that it is a very safe strategy of treatment. And as I said about the Andexanet Alfa, the ESA guidelines are very clear. They suggest against use of Andexanet Alfa before IVT, because in the Senta Frol trial, it was clearly written or found out that there is approximately 10 and a little bit more % of patients who suffer thrombotic events. So therefore, we know that in the patients with acute stroke, there is a procoagulability state, and so we cannot use the agent which has a prothrombotic activity. So about the Andexanet Alfa, the conclusions at the CONy pro et contra debate was very clear. So we should not use the Andexanet Alfa before IVT in patients on factor Xa inhibitors who suffer acute ischemic stroke. And about Idarucizumab, there were separate opinions if using it or not, because there is still, the concern regarding the price. It is not, let's say, very cheap to use the Idarucizumab, but on the other hand, we know that if we are saving, let's say, lives with that, and that we improve the functional outcome in those patients, it is definitely to use the Idarucizumab before IVT. So I had that part of yes, so with using Idarucizumab before IVT, and yes, I think that there is actually quite enough of reassuring data that it is definitely safe and it is also effective.